Hello, future PTAs. I hope you're doing well. Today we're going to talk about the cerebral cortex. First, we'll go over a little cellular anatomy. So there's around 25 billion neurons within the brain. The corpus callosum is what connects the two sides of the brain, the two hemispheres. So it's like a bridge that connects. If it is missing, that is called agenesis of the corpus callosum. If it was not developed and someone was born without it, that makes it really difficult to do coordinated movements with the two sides of the body. Even walking could be difficult, but especially with the hands, like by manual task where you're holding one thing and moving the hand to like unscrew a lid or to zip a zipper, where it takes both hands coordinated together to do that movement. The internal capsule, this connects the brain with the spinal cord, so the brain to the body. And if it is damaged, it will have a significant impact on the function, whether you're able to move or feel or any of the functions that need the brain and spinal cord to work together. We will go over the lobes of the brain, of course, the frontal, parietal, temporal, and occipital lobes. So first, let's start with frontal. So on the top here, this is the homunculus. That is when regions of the brain are organized to represent to show what parts of the body they are connected to, like what sensory input is processed in that area or what motor output is originated in that area. So the frontal lobe, remember, we think personality, we think our filter, our logic and our reasoning and our planning abilities. So all those centers are there in the frontal lobe, but it also controls movement and problem solving even with movements. So in the frontal lobe, we have our primary motor cortex, which controls our voluntary movements of the opposite side of the body. So remember, the right side of the brain controls the left side of the body. It's organized in that homunculus. So that picture as if somebody cut a brain and we're looking at it from the front there. So the legs are kind of in the middle, and then the trunk, and then the neck, arm, hands, and then a big area for the face, especially the mouth and the tongue, as we go out down the side of the brain. The premotor cortex, which is right in front of the primary motor cortex, and it's controls trunk and proximal limb movements, and it's also responsible for body part ownership. So the ability to kind of connect with and understand, this is my hand, this is my body. And so if that premotor cortex is damaged, it could cause neglect of one side of the body. So like if it's damaged on the right side, they may neglect the left side of the body. They just don't even recognize it as their own. So oftentimes they won't look towards that side. They won't use that arm or leg. Like it's just not even there. They'll drag it along or run into things with it because they're just not paying any attention or there's no awareness that it's part of them. As PTs, one of the things that we do to help somebody who has damage to that area is we have them look to that area. Of course, we try and have them use that side as much as possible. Weight bearing on that side, even on the arm, is really important because weight bearing gives you so much sensory input back to the brain to just wake that part up and say, hey, I'm here. And then we do a lot of things in front of the mirror so that a patient can look in the mirror and see that side of the body and start to process and realize, this is my arm, and the brain starts to reconnect some of those pathways. So that they're able to do more and more functional tests. Sometimes we even have a plumb line hanging so that they can see what's midline and where their body is and kind of reorient themselves that way. Or another is constraint induced movement therapy, where we will actually take either a sling or a oven mitt or something and put it on the side of the body that's not affected to try and force more functional movement of the side that's affected. And we'll have them do a lot of fine motor tasks, zipping, twisting, buttoning, things like that they need to do, brushing, for ADLs and for, their daily tasks. Sorry. Sorry to make you yawn. but we will have them do those. And what will happen is it kind of forces the brain to rewire and increase the function of that side of the body. And then last is that supplementary motor cortex. It's kind of in the middle there, in front of the primary motor cortex. And that is responsible for your motor planning and your muscle memory. So let's see, I got a few things on the side I wanted to say. And I think I have something on another slide about the supplementary motor cortex. So neurons in the motor cortex are called upper motor neurons. So upper motor neurons are neurons in the brain and spinal cord. Lower motor neurons are in the peripheral nerves. Something we'll go over later in a different lecture is the different tracks. So some of the tracks that lead to the upper motor neurons are the corticospinal and the corticobulbar tracks, which we'll go over later. If we have damage to the supplementary motor cortex, see, I knew I had it sitting here. I just didn't scroll down far enough. It can cause apraxia, which makes it hard to perform like our routine movements because we don't have that muscle memory. So if the muscle memory is affected because of the supplementary motor cortex being damaged, then things like brushing our teeth or getting dressed, we'll have to relearn how to do because our body has forgotten how to do them now. All right, our clinical pearls, some of our things, our takeaway messages as PT. So if somebody has a stroke, some of the expected areas of weakness related to the homunculus. So on the left side of the picture, we have the motor homunculus, which is, of course, your movement. And the right side is our sensory homunculus, which is the sensation, the feeling. They're very similar. Of course, your feet, legs are in the middle, genitals are in the middle. Then it goes out towards trunk. Hand has a really big area that processes that. Face, lips, tongue have very big areas that are dedicated to either processing the sensory information or controlling the motor movement. So if the middle cerebral artery that supplies the middle portion of the brain, so once again, they've cut the brain here and it's like we removed my face and the whole front of my face and you're just looking in on it. That cream colored area of the brain is the area that is supplied by the middle cerebral artery. So if that's affected, then your face, your arms, hands are going to be most affected if you have a stroke in that area. If the anterior cerebral artery is affected, now that is represented as the blue portions of the brain in this picture, then it will most affect your legs, your trunk, and then it can also affect bowel and bladder control. And then remember, that is where that supplementary motor cortex was that we just learned about right there, that purple part in the middle. It's that same type of area. So it can also affect your motor control and your muscle memory. So your ability to do those tasks that you've done all your life that you don't even put any thought into now. And then that bottom portion, that posterior cerebral artery, as you see, it's not really affecting much of the homunculus, but what it does affect is the occipital lobe and parts of the temporal lobe and the thalamus. So it can cause a lot of problems with your vision. It can cause this central thalamic pain syndrome, which is like a burning, tingling sensation and hypersensitivity, where basically all input that comes to that side of the body that's affected is perceived as pain. So any light touch, anything is perceived as pain. And then a lot of your memory can be affected if the posterior cerebral artery is affected. All right, with your frontal lobe, the Broca's area, that's actually right behind that VLPFC in the picture. So it would be right in the back of the frontal lobe, down low near the temporal lobe. That is responsible for expressive language. So your ability to express yourself through speech. So most people have a highly developed or a big Broca's area on the left side, because remember, the left side of the brain, we think language. So most of the time, the Broca's area is primarily on the left, and the same area on the opposite side of the brain that would be Broca's on the left actually is responsible for producing your hand gestures, your nonverbal communication, your tone of voice, your facial expressions. So the things that you say are in the Broca's area on the left, and in that same area on the right is how you say them. With our orbitofrontal um, cor cortex, that is where, so it's like an orange color on the picture, your impulse control, your inhibition, and your ability to carry out plans is all processed there. The dorsolateral frontal cortex is where your analytical thinking is, your planning, your problem solving, your attention, your focus. So, where the term comes when you hear somebody say, hold it in the front of your mind, that is actually in reference to this dorsolateral frontal cortex. Because people are saying you need to hold it there long enough in order to follow through. You need to actually be able to have your attention and focus on it long enough to process it and be able to do something with that information. So that area of the brain they're actually referring to that does all that is in the frontal lobe. That's why we say in the front of your mind, and it's that dorsolateral frontal cortex. With the ventromedial frontal cortex, this connects your emotions with your thoughts. So back in the day when people had depression, they used to do this frontal lobotomy where they would stick something like up somebody's nose and just like scramble up their brain tissue. Sometimes they would even actually put it right under like the eye socket and like an ice pick back there and just damage their brain to as a treatment for depression. So they may not have been as depressed, but they probably didn't really have any thinking abilities, like none of that logical higher level function. It was all gone. So we don't do that anymore, thank the good Lord. But that is the portion of the area that they were trying to damage to treat depression. The anterior cingulate gyrus, this integrates your thoughts, your motivation, your attention, and your behavior. And scientists have related an overactive anterior cingulate gyrus to anxiety. People who have high anxiety typically have that portion of their brain that is overactive, and an underactive to apathy. People who just have low motivation and I just can't seem to make myself do anything. I can't, get motivated enough. Then often that portion of the brain is actually underactive. We talked about the Broca's area there in the back of that frontal lobe near the temporal lobe. It is responsible for helping you produce speech. And if it is damaged, then it's hard to express yourself through speech. So you'll have Broca's aphasia or expressive aphasia. So the patient can understand what you're telling them to do, but they're often unable to actually put the words together and create meaning through their words. So they may be able to utter a few words, but typically they cannot connect them or make real meaningful sentences. So I had one patient after a stroke that he could understand anything we said. If we said, pick up your shoe, take it in here, place it there, he could follow all those directions. But then when he went to speak, he would just say, pa, 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 pa. And you could tell he was trying to say something by the inflection of his voice. Then he would get super frustrated and start crying and be like, pa, 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 pa. But every single thing he tried to say for him came out as just one syllable, pop. And so it's a little different for every patient, but it can be something like that where there's a word or two they just repeat, or where there's random words they throw out, but they just don't go together. They don't have meaning to them. With the parietal lobe, this is your perception and your processing center. So it helps you perceive sensation. So it helps you feel pain, temperature, pressure, touch, vibration, proprioception. Remember, proprioception is that awareness of where your body is in space. The brain, once again, creates that sensory homunculus where uh, where it is organized by, let me go to one picture of it and then I'll come back, by the portion of your brain that is dedicated to feeling those sensations in certain areas of your body. So it is very organized. All of your sensations in your foot are all processed in one part of the brain. All of your sensations for your face are all processed in a different portion of the brain. That is the sensory homunculus. If you were to take that and make a person out of the amount of brain tissue dedicated to each party and translate that to actual sizes of a person's body, then it would make this homunculus we see here. So they have very large hands, feet, face, lips, tongue, and genitals, which I have covered with the hand, but a small trunk and arms and legs, because much less of that body. That's why if you have a paper cut on your finger, sometimes your brain focuses more on that than, damage to your rotator cuff. It's like a big area of your body damage versus a little tiny thing, but you have so many sensory neurons that are dedicated to your hand because you need to be able to feel everything you're touching and process that way. That it's just a different way that your brain perceives it and how much information and how much brain matter is dedicated to that. The somatosensory association area is also in the parietal lobe, and this is where sensory input is interpreted. So almost all of the association areas, whether it's sensory or motor, is where the input for that specific sense is actually interpreted. So the parietotemporal association cortex, this is where your abstract thought, your reading, writing, math, your spatial perception, where all of that is perceived and interpreted. And then your angular gyrus is where written language is processed. So with the somatosensory association area, in the right hemisphere of our brain is our sensory reception of the body, our self-image. So actually, if that area is damaged or overactive or has some issues there, then it can cause eating disorders. It can cause unilateral neglect, just completely avoiding the other side, when there's dysfunction in that region, because that's where our self-image is. So if you know somebody that's just always down on themselves, well, is it nature or nurture? Is it the way their brain is actually made, or is it because, of life experiences they've had that have taught them to do that? All right, with our occipital lobe, we think occipital, we always think vision. So the primary visual cortex is where visual perception happens. Of course, the visual association cortex is in front of it, and that's where visual stimuli is actually interpreted. Again, the association cortex is where our stimuli is interpreted. One thing that's really cool is visual input from one side of each eye goes to the opposite side of the brain. And so if one side of the brain is damaged, you can have something called hemianopsia, where the opposite visual field is just completely cut. You don't see anything on that side of the body. So it's the opposite of where the brain is damaged. So if this side of the brain is damaged, you may have a visual field cut where you're not seeing anything on the opposite side of the body. That's hemianopsia, because none of that input coming from the eyes that goes over to that side of the brain is being processed. Agnosia is your ability to see but not recognize. So you are able to see, sorry, but you are unable to recognize objects by sight. So you see that there's a book sitting there, but you can't tell the difference between the book or a hat. There's actually a book out there called The Man Who Mistook His Wife for a Hat. And it's about a man who had his visual areas of his brain damaged, I think related to a stroke. It might have been a brain injury, where he couldn't recognize his wife like as a person. Like he couldn't like see her and recognize her. Um, and then, as we talked about earlier, strokes to that posterior cerebral artery often affect the vision the most. All right, your temporal lobe. This is where the limbic system is. Your limbic system has some of your basic functions like your hunger drive, your sex drive, also connected to emotions and things like that. It the temporal system also contains your auditory system, your olfactory system, so the sense of smell, and some of your areas that help you recognize faces. It's really cool because input from both of your ears is received by both sides of the brain. So this is really the only thing in our body that both sides are fully interpreted by both sides. On the eyes, there's input from one visual field on each from each eye that goes to the opposite side of the brain, but from your ear, input from both ears goes to the whole brain, goes to both sides of the temporal lobe. The primary auditory cortex is where sound is perceived. The auditory association is where it's interpreted. And then we have the Wernicke's area. So kind of similar to the Broca's area. This is where receptive speech um, is where speech is received. So with Broca's area, speech is made, it's produced, and with Wernicke's area, speech is perceived. So if there is damage to Wernicke's area, then the person will not be able to understand speech. And it's not just verbal speech, it's also written communication, it's also sign language, and they can't even understand their own speech. So even if they have the ability to think and process and produce a sentence, they can't hear it and know what they're saying. So the Wernicke's area, just like Broca's, is primarily on our left because the left side of the brain is primarily dedicated to language. So the Wernicke's area is primarily on the left, but on the right side, there's also an area that interprets nonverbal communication. So remember, in the Broca's area, on the right side, there's an area that produces your nonverbal communication, your hand gestures, your facial expressions. And on the right side, in the Wernicke's area, there's an area of your brain that's dedicated to receiving and processing that nonverbal communication from others. So there is one other cool thing about the temporal lobe. There is a portion of your temporal lobe that is actually dedicated specifically to music and hearing and listening to interpreting music. It's larger on the right side than left, but if you remember, the right side was where a lot of our creative thinking, our music production and interpretation is kind of housed. So it kind of makes sense that that is where that area dedicated to music would be. And that area has a lot of connections to our emotional centers in the brain. The limbic system also is very tied into your emotions. So that's one reason why we can hear a sad song and immediately get sad, or we can hear a good song and get hyped up. So music is directly tied into our emotions. Temporal lobe. The inferotemporal cortex is what helps you with recognizing faces, objects, colors, things like that. The primary olfactory cortex receives your odors and perceives those. The amygdala, it actually is where fear and anger are processed, and there's connections between the amygdala and the hypothalamus, which is the hypothalamus can change your heart rate, your respiratory rate, your blood pressure. So that's why you can have changes in those in response to your emotions like fear, anger, embarrassment, things like that, how they can immediately change your heart rate and your respiratory rate. Is because of those connections there. The hippocampus, which is kind of in the middle of that brain, still in the temporal lobe, though, helps you create your long-term memories. So this is one of only two areas in the whole brain that can create and generate new neurons throughout your entire life. Most of the neurons in your brain are developed at a young age. A few of them, especially in your frontal lobe, can continue to develop and produce new neurons past age like 17. But most areas are finished developing and producing new neurons by your 20s at the latest. And for men, it might be just a little bit later. Sometimes they can continue to grow and process and things a little bit later in life. But This area, the hippocampus, can continue to make new neurons throughout your entire life. So that's why even in your 80s, you can create new memories. If you didn't have that ability, then you wouldn't be able to after a certain age. So you can continue to learn and create memories throughout your entire life. All right, damage to that inferotemporal cortex can cause a thing called prosopagnosia, where you cannot recognize people's faces. Because there's an area that's dedicated specifically to recognizing faces, if that area is damaged, then you can't any longer recognize faces. Um, anosmia is the loss of the sense of smell when that olfactory cortex has been damaged. Amnesia is an inability to make new long-term memories, and it's related to a damaged hippocampus. Um, and one thing that's really interesting is if you are really stressed, the hippocampus, thought I needed to sneeze, will actually shrink over time with frequent stress. But if you consistently exercise and push yourself to do challenging things without, going so far off the board that it's like super stressful, then the hippocampus can grow. So we can actually, if you remember, I talked about it the first lecture, we can change the size and the dedication of different parts of our brain based on what we do. So we have a lot more control over our own brain than we think. If we choose to focus on positive things, then the positive areas of our brain will grow and develop. And if we choose to focus on negative things, then the areas of our brain dedicated to negative thoughts will actually grow and develop and become stronger. So whatever you feed your brain, whatever you decide to focus on really does affect the actual neurons in your brain dedicated to that. All right, damage to the Wernicke's area can cause receptive aphasia, where people are unable to understand any form of language. I talked about that. They may be able to speak in a smooth way, but their speech doesn't really convey any meaning. It's hard for them to typically to actually convey meaning through their speech, and they're not even able to understand their own words. If Wernicke's and Broca's areas are both damaged, then global aphasia will occur, where they cannot produce or understand speech. Remember, Wernicke's is understanding speech. Broca's is producing speech. One way that people often can remember it is it with Broca's. If that area is damaged, you'll have broken speech because you cannot produce good, meaningful speech. Here's just a quick little reminder of what happens in each lobe. Frontal lobe, that's thinking, planning, processing, problem solving, emotions, behavior, personality, decision making. All of those higher level executive functioning happens in the frontal lobe. The temporal lobe is a lot of your memory, your understanding language, and even producing some of your language. Some of that happens in frontal lobe at the Broca's area. Your hearing is processed in the temporal lobe. Your facial recognition is processed there. Your vision, your speech, and your emotions are all processed in the temporal lobe. And remember, input from both ears is processed in both sides of the temporal lobe. The parietal lobe, this is where your parietal perception, where your sensation is all processed and you're able to feel things because of the parietal lobe. You're able to recognize objects by feel, by sensation. Your spelling is in your parietal lobe. Your knowledge of numbers, your visual, spatial processing, all of that is in the parietal lobe. Occipital lobe, primarily vision. And then your cerebellum, which we didn't talk a lot about, but that is your coordination, your balance, your motor control. With your meninges, we've talked about these in the first lecture, but just to jog your memory, the meninges protect the brain and the spinal cord from infection and from physical trauma. So you have that dura mater that is on the outside. It is the toughest. It has a lot of pain receptors. You have the arachnoid mater that is in the middle. Between those two, there's some space There's dural venous sinuses, which are actually in between the two layers of the dura mater, and they actually drain excess fluid from the brain into the internal jugular vein, so don't have brain swelling. Then under the arachnoid is that subarachnoid space where cerebrospinal fluid is housed. There are actually projections, they're called arachnoid granulations, that go from that subarachnoid space up into the dura mater, the dural sinuses, to absorb the excess cerebrospinal fluid and then recycle that fluid back. So our blood volume constantly changes quite a bit, and we filter it and we pee a lot of it out, and we have to drink more to replenish it. The cerebrospinal fluid, although it's filtered some, it basically recycles and is reused a whole lot. We don't really push a lot of it out or replenish a lot of it. It's just constantly being recycled and reused. And absorb back into the CSF circulation. So that very top picture, it shows the ventricles of the brain. The ventricles are where cerebrospinal fluid is produced and where it's stored. So that's that middle section. The big portions in the middle are the ventricles. And then all around, the little blue lines all around, is that circulation of the cerebrospinal fluid, where it's absorbed and it's re-entered into the circulation and keeps going round and round to keep the brain cushioned, to provide the nutrients, to provide the immune support for the brain, and also to remove toxins through the brain. So the meninges and the cerebrospinal fluid help protect the brain from infection, from physical trauma, and kind of cushion that brain so that it's not getting damaged. All right, that is the end for us today. If you have any questions, let us know, and we will see you next time.